Hi, I'm Melissa DeSimone, Breast Cancer Nurse Navigator. I'm taking over McLaren Northern Michigan Foundation's social media today to share this special program with you. The Breast Cancer Navigation Program ensures that patients newly diagnosed with cancer receive timely diagnostic testing, treatment, and support to overcome any barriers. I work exclusively with patients with a breast cancer diagnosis, and after receiving path results, I follow up with ordering providers and guide patients through their breast cancer journey from the time of diagnosis. I focus on each patient's unique needs to help them overcome barriers to care, coordinate appointments with surgeons, medical and radiation oncologists, and genetic counselors. Donors to the foundation help establish this program and have supported it since 2013. Follow along today to learn more. Hi, Melissa here again. Jeannie Melton, the Lung Cancer Navigator, and I have special certifications to work as nurse navigators. I'm an oncology certified nurse and certified breast care nurse. The CBCN certification encompasses the entire spectrum of breast care nursing practice. Donors helped fund training and conferences that prepared me for the certification, such as attendance of the Harold Freeman Navigation Institute, National Consortium of Breast Centers Conference, and Memorial Sloan Kettering Breast Care course. I had the honor of serving on the ONCC's Test Specification Committee to redesign the credentialing exam. I was excited to have the opportunity to infuse more navigation content into the test. One of the most important things I do for patients is help them overcome barriers to care. The first time I speak with a patient, I complete an assessment to identify any barriers they may have. For example, if a patient has a financial barrier, I may help them to apply for assistance through Patient Financial Services or the McLaren Northern Michigan Foundation, or outside grants which might help pay bills. If a patient has a transportation barrier, I may help them to obtain gas cards, coordinate van rides, or obtain mileage reimbursement through their insurance if possible. If a patient requires extra emotional support, I might make a referral to a support group or counseling. If a patient has insurance concerns, I assess to determine if they qualify for the Breast Cancer Medicaid program and help them apply. We want to understand and support each patient's unique needs and make sure they have access to the care they need. Thank you for helping us to make this possible. Surgery is usually the first step of breast cancer treatment. As Breast Cancer Nurse Navigator, I help patients get set up with a surgeon, join them for their first appointment, help answer questions, and I'm available for follow-up. Before surgery, I call patients to review the entire process so they know what to expect. After surgery, I visit with patients and talk them through their post-op care, provide education and resources. I also provide patients with a breast cancer comfort kit, post-surgical camisole, and heal and comfort shirt as needed, which are funded by the McLaren Northern Michigan Foundation. I call patients after they go home from surgery and ensure they're comfortable removing their dressings, feeling well, and answer any questions they may have. Radiation therapy is used to lower the chance of cancer coming back. It is especially important in reducing the risk of local recurrence in breast cancer patients who've undergone a lumpectomy. For some patients who need radiation, there's a new exciting option that's been introduced at McLaren Northern Michigan in the past 3 years. Traditional radiation is delivered every day over the course of 4 to 6 weeks. This new form of accelerated radiation is delivered using a catheter that is inserted into the lumpectomy cavity. Using the catheter, radiation is delivered twice per day for only 5 days. About 30% of patients qualify for this. It's beneficial for Northern Michigan patients who may be traveling from the UP, Beaver Island, or Presque Isle. They're able to stay in a hotel here in Petoskey for a week, and for patients experiencing financial hardship, the Foundation's Patient Assistance Program provides lodging assistance. Thanks for following along today as we talk about my role as Breast Cancer Nurse Navigator. Genetic testing plays a huge part in identifying the best and safest treatment plan for patients based on future risk of breast cancer. Many patients qualify for genetic testing based on their family history, and the testing recommendations are constantly expanding. Most patients who have genetic testing will be tested for a large panel of genetic mutations, including the well-known BRCA mutations, among many others. Knowing future risk is empowering, and it allows patients the option to have additional screening or prophylactic surgery, such as bilateral mastectomies, to reduce future risk. Identifying a specific mutation allows the patient risk reduction options for other cancers associated with that mutation as well. Also, if a mutation is identified, then family members will have the option to be tested, which gives them the chance to take risk reduction measures before a diagnosis even occurs. For many patients, understanding their diagnosis is confusing and overwhelming. To help patients better understand, I put together an education care plan for each patient. The care plan includes all of the information included on their pathology report, genomic testing, staging, and every step of treatment numbered in order of occurrence. I provide and review this care plan at the first medical oncology appointment for every patient I navigate, along with a folder which includes their pathology reports, their oncologist nurse's card, and any other resources they may need. The goal of this care plan is to ensure patients thoroughly understand their treatment plan and diagnosis. Also, at the first oncology appointment, I make sure patients have a referral to the lymphedema clinic and certified mastectomy fitter if needed. The McLaren Northern Michigan Foundation has a fund which provides assistance for sleeves and prosthetics. Thank you for following along today and supporting the Oncology Nurse Navigator program.